People say eating sugar can cause diabetes. Most of the people believe that eating sugar can cause diabetes. In fact, most of the diabetic patients often restrict themselves from eating the food that are rich in sugars. They often avoid some fruits which are rich in sugars. The diabetic patients often use sugar-free sugars in their diet because they believe that eating sugar can cause diabetes. But the question is, do you really think so? Does eating sugar can really cause diabetes? Come, let's check it. As you all know that the chocolate is rich in sugar, and sugar means carbohydrates. What happens to that chocolate when it enters into my body? This carbohydrate which is present in the chocolate is broken into many simple glucose molecules. These glucose molecules will reach my pancreas. Pancreas is a gland which is present just below my stomach. Thereby, the beta cells in the pancreas, they secrete a hormone known as insulin. And this insulin is just like the school principal. How the school principal manages the discipline and regulates the system, the insulin also manages the glucose molecules and instructs the glucose molecule to reach the target sites. The liver is the target site, the muscle cell is the target site, the fat cell is the target sites. So the glucose molecule should reach the target sites and release the energy in their respective target sites. And this is instructed by the insulin. This is disciplined by the insulin. Just consider this example. What happens in my liver? As the insulin, it directs the glucose molecule to go into the target sites. The insulin in the liver attaches itself to the receptor cells. As soon as the insulin attaches itself to the receptor cells in the liver cells are going to absorb these glucose molecules. And among these absorbed glucose molecules, few of the glucose molecules are utilized in the form of energy, whereas the unused glucose molecules, they are stored as glycogen in the liver. So whenever there is an emergency, whenever there is a starvation in the body, these glycogens can be released in the body so that we don't feel weakness. So like this, all these glucose molecules which were more in the bloodstream just now, after when the insulin is released, the glucose molecules reached the target sites and got absorbed in the respective cells. In the liver cells, in the muscle cells as well as in the fat cells. So like this, the glucose molecules which were more in the bloodstream now got absorbed into respective target cells. How it happened in the liver? The same thing it happens in the fat cell, the same thing it happens in the muscle cell also. And now the glucose molecules is regulated in the bloodstream. This is what happened in my body, how the carbohydrates got converted into glucose and absorbed by the respective target cells when I eat that chocolate. Now let us consider another situation. What if I am fasting? Consider now my stomach is empty. I have not eaten anything since from the morning. Does it mean there is no sugar in my blood? Let's check it. Let me see what pancreas is doing. Well, the alpha cells in my pancreas will secrete one more hormone called as glucagon. And let us check what this glucagon does in the liver. Let's see what happens in my liver. The hormone glucagon, it fixes itself to the receptor cells in my liver. Acting on the instruction of glucagon hormone, the liver cell is going to convert glycogen into glucose, and this glucose is released into the bloodstream by the liver cell. If you want to check your sugar level in the blood, even you are fasting also, after eating as well as or during fasting, in both the cases, the sugar level is maintained in the bloodstream. So now tell me, is that eating sugar causes diabetes? No, a big no. Eating sugar does not cause diabetes. Most of the people say that eating sugar causes diabetes, but it is a myth. Then what really causes diabetes. With the above metabolism of sugar, it is very clear that I think it is overeating that causes the diabetes. It's not the eating sugar that causes diabetes, but it is overeating that causes diabetes. Overeating is just not eating only sugar. It is eating any kind of food at any time, any amount of food at any place. When I eat a french fries also, when I eat a burger also, and pizza also. This process of overeating, what it does when it enters our body. But in this case, we have taken any amount of food and we have not regulated the amount of food. We don't know how much we have consumed it, but what exactly it does into our body when we eat it. Let us check it. Once again, the carbohydrates are broken down into simple glucose molecules. When there are lots of glucose molecules in the bloodstream, the glucose molecules now enter the pancreas. The beta cells in the pancreas, they release a hormone called as insulin. Now once again the insulin directs the glucose molecules to reach their target cells, that is the muscle cell, the liver cell as well as the fat cell. Let's see what happens in the liver. When the insulin fixes itself in the receptor in the liver cell, in this case the glucose molecules are not absorbed by the liver cells. We can notice that the glucose molecules are struggling hard to take their entries inside the cell, but it seems the door is locked. The cells in the liver are unable to open the door so that the glucose molecules can enter inside. Even though the insulin has fixed itself on the receptor cell, but the glucose cells are not penetrating inside the liver cells. The same case happens in the muscle cell also, in the fat cell also. All the glucose molecules are not absorbed in their target cells. As a result, the glucose molecules are left in the bloodstream, and this is what happens in case of diabetic patients, and that too this is a result of overeating process. The glucose molecules were not absorbed by the target cells, they remained in the bloodstreams, and that increased the glucose level in the blood, and then we say the glucose level is high in the blood, and that condition we call it as diabetic condition. In case of overeating, we also notice that since the glucose were not absorbed by the target cells, and in reverse, every target cell, say for example the liver also start releasing glucose thinking that there is no glucose in the blood. And the same thing is done by the adipose cell and the muscle cell. They release their fatty acids into the blood cell, making the process still worse, and that results in the increase in glucose molecules in the bloodstream. Then what went wrong? Though the insulin hormone was released, the insulin hormone also fixed itself on the receptor cells on every target cell. So in case of overeating, overeating means gaining more weight. Gaining more weight means deposition of more fatty tissues in the body. Just now we noticed, though the insulin fixed itself on the receptor cell in the liver, but not able to open the lock so that the glucose molecules can enter into the liver cells or the muscle cells or the fat cells. This means in such a condition, our brain being unresponsive to the insulin. The insulin failed in signaling its chemical messages. Since it was unrecognized by the brain, our brain was left in the confusion state since there was many events happening in the body due to the process of overeating. Since the liver started releasing its glucose, also the muscle cells and fat cells started leaking its fatty acids into the bloodstream, making the situation still worse. Now the diabetic blood is rich not only in sugar, but the blood is also rich in blood pressure. It is also rich in blood cholesterol. So the process of overeating made the brain unresponsive and made it as an insulin resistor. As a result, every target cell, the liver cell, the muscle cell as well as the fat cell, they started releasing their own glucose and fatty acid into the bloodstream. That created a pressure in the blood. It is the condition of the brain not to identify the chemical message of the insulin, and that was due to the process of overeating. So, by eating sugar, diabetes is caused is just a myth. In fact, diabetes is caused in a situation where our body is not able to utilize the sugar, is not able to burn the sugar, where the insulin is not able to pass its chemical messages, where our brain becomes insulin resistor. I think in the name of diabetes, experimenting on the entire sample of population and in turn drugging them, this process is not going to lead us anywhere. I think it is a wake-up call for all the mankind. Because the drugs that we take, that might help during the moment, but in the long run, even these drugs can also have adverse effect on our body, what we call it as adverse drug reactions. In fact, most of the chemicals which are used in the preparation of these drugs is the only cause of other disease such as cancer. It is a wake-up call so that we can educate ourselves to know what exactly the diabetes is and break all the myths, and let's practice a healthy lifestyle and a healthy routine so that we can lead a healthy life.